And an ABC News investigation is taking a closer look at the origins of COVID-19 and the Chinese lab at the center of so many questions. Now, most scientists say they believe the virus emerged naturally, but there are growing calls now to investigate the possibility of an accidental leak from a lab in Wuhan, China. ABC News senior national correspondent Terry Moran has more.
The Wuhan Institute of Virology is one of the leading centers of research on bat coronaviruses. For years, the lab has been collecting potentially dangerous viruses, some from an abandoned copper mine in southwestern China.
In 2012, there were these 6 Chinese miners who were sent down into a mine in southern China to clean out the bat manure. They all got infected with what now looks like COVID-19-like symptoms. 3 of them died.
Researchers from the Wuhan lab collected viruses from those caves, but they say none matches the virus that caused the pandemic.
There is no virus that's close enough that you could use any type of gain research to get to SARS-CoV-2. Now, you could hypothesize, I suppose, that the investigators at the Wuhan Institute of Virology had some virus that was closer, and they just weren't telling us about that.
Do you believe that this virus spent any time in a laboratory?
Before the pandemic, absolutely not.
And that remains the consensus among most virologists, that this coronavirus has none of the telltale fingerprints of bioengineering. Now, concerns that there may have been an accidental lab leak, or possibly something more disturbing. The U.S. intelligence community reporting that there may have been research taking place at that lab that the public doesn't know about. In January, the State Department issued a fact sheet on activity at the Wuhan Institute of Virology that alleged that in the past, the lab collaborated on projects with China's military that it kept secret from the world. ABC News has also learned from a former State Department official that the U.S. government was aware of financial accounts tied to the Chinese military that were funding the Wuhan lab. But this March, one of the lab's directors, Shizhong Li, known as the Batwoman for her extensive research on bat coronaviruses, directly addressed the allegation that research was being conducted for the Chinese military.
We heard the rumors that it claimed that in our laboratory we have some project, blah, blah, with the army, blah, blah, this kind of rumors. But this is not correct.
The question is, was Shizhong Li telling the truth when she stated emphatically there was no Chinese military involvement prior to the outbreak at the Wuhan Institute of Virology? If there was, her credibility flies out the window.
Now, all eyes are turning to the next step in this global investigation. Experts bent on parsing fact from speculation.
It's important to stay open-minded because we don't know exactly what happened. We are scratching the surface.
A final note, more than a year ago, top scientists published a letter in the prestigious medical journal Lancet that dismissed the lab leak theory. They called it a conspiracy theory, and it was hugely influential at the time. So ABC News reached out to all 27 scientists who signed that letter. About a dozen responded. And now several of them are telling us they aren't really sure this thing had a natural origin. And one scientist telling us he's flipped entirely. He now believes the lab leak theory is the more likely possibility. Diane?
Very interesting. Terry, thanks for that. ABC News senior national correspondent Terry Moran. And you can see more of that ABC News investigation tonight on Nightline. And joining us for more on all of this, let's go to ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein. Dr. Brownstein, good morning. So what do you think as you hear about this evolving investigation, and what are you looking to hear as they start to reveal more about the origins of COVID?
Yeah, good morning, Diane. I mean, this is something that actually my lab at Boston Children's and Harvard has been studying for many years. The idea that viruses move into human populations from animal populations. But we have a lot of open questions. We do not have a definitive conclusion on the origins of this virus, and we don't even know where it started. There are many questions as to where this virus began to infect humans at low levels, even prior to Wuhan. Now, many of my colleagues, foremost authorities in this, still say that this is a zoonotic origin, meaning that it moved from animals into humans, and it likely came from close contact with handling an infected animal. But we still don't know this intermediate host, right? This animal that became infected, then that moved that virus into humans. And again, we don't even know where to look, because the seafood market was one place, but there are many other places to look for this origins of this virus. Now, of course, this lab leak phenomenon is something that is gaining steam. And I think partly it's because we haven't had full transparency from the Wuhan Institute of Virology. So they haven't really allowed us to fully rule out this lab leak. There's been, various data sources that have told us that potentially there was infected lab workers, but we just don't know. We need more transparency and cooperation from the Chinese government to really be able to fully uncover. And this is not about finger pointing. This is just about trying to understand the origins. We may never know what happened, but it's so important to fully understand this because it's what allows us to improve public health capacity.
Yeah, and so let's talk about that. Why is it so important to understanding the origins here? Is this something that's crucial for getting this pandemic under control, or is this more about preventing future pandemics, or both?
Well, from my perspective, as someone in public health, it's all about understanding the origins to sort of prevent a future pandemic. It's not about finger pointing. I recognize there's a political angle to this, but if we understand how these viruses emerge, we can prevent them in the future, right? If this is a zoonotic spillover, we need to be putting more resources into identifying viruses in animal populations that are at the interface with humans. If it was a lab leak, then of course we need to be putting more work into safety practices. The problem is that we assume that this identification is really fast. For SARS, it took many years, 5 years to identify the host. For Ebola, we still don't even know it. And so, the key here is to put the resources in, identify how these things happen, and so that we can identify future viruses that might spill over into human populations.
And the first vaccine in the U.S. outside of trials was administered just 6 months ago to the day. Now we have more than 62% of the eligible population in the U.S. who received at least one dose so far. But vaccination rates are dropping, and now some experts are expressing concerns that this Delta variant, first discovered in India, could lead to a new wave of infections in the U.S. this fall. So, Dr. Bronstein, how worried should we be about this, both those of us who are vaccinated and those who aren't?
I am worried about Delta variant. I've been watching what's happening in the UK, and we're starting to see a surge of cases. I'd be worried if I was unvaccinated, right? This is the most contagious variant yet. We saw it wreak havoc in India, the spikes in cases that are taking place around the world. Yes, when you look at the US, we see cases and hospitalizations and deaths dropping. That's great. But then when you look at the vaccine rollout, we have many parts of this country that are at, just 2/3 vaccinated. And so, and even way less in some parts of the South. I'm worried that we might see this summer or fall surge with the Delta variant, especially among unvaccinated people. And the reason I'm concerned about Delta is that it's more infectious. It's potentially more severe based on the data we're seeing out of the UK. And it looks like it potentially could evade the vaccine if you're not fully vaccinated. And there was data in the UK that suggested that just after one shot, the vaccine was only 33% protected. So this puts a lot of pressure on all of us to get the vaccine, but get fully vaccinated. And, for those that are unvaxxed, really consider now is the time to do it and to really prevent a future surge of this variant and really get us to the other end of that light of the tunnel that we keep talking about over and over again.
We also know this new study now is out finding that the NOVAVAX COVID-19 shots are about 90% effective. How significant is that in the global push for vaccinations?
Well, I know this is, going to look like just one more vaccine, and I think not everyone might get super excited. I'm personally very excited about it. It's, of course, the data looks very similar to Moderna and Pfizer, and it shows 100% efficacy towards severe disease, 93% effectiveness against variants. And so Novavax is going to look for approval in the fall. May not make a huge dent here in the US, but if you think about global vaccine equity and getting this pandemic under control everywhere, well, they have a stockpile of 350 million doses that could go towards immunizing the globe. That's a very big deal. The other part I'll mention is that this protein vaccine is an interesting potential weapon when it comes to boosters. We saw that it worked really well for variants. it may be a good combination to the mRNA vaccines as an additional booster later on. So quite excited about that. The results from the trial were great, very mild side effects. So I think this could be a great vaccine, especially for people that might be concerned about the mRNA vaccines. This is a good alternative, but we still have to wait for data around Delta variant. That's going to be the key to making sure that it protects you from these upcoming variants that we're all concerned about.
All right, Dr. John Brownstein, always great to have you. Thank you.
Thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.